Well, good afternoon, everyone, and thank you for taking the time out of your day to attend our webinar. This webinar is titled Addressing SDOH Issues for Essential Workers in Emergency Management. In case you have any technical difficulties, yours or on our side, feel free to chat it on our chat box. Someone will be monitoring the chat box, so any questions, concerns that you have, feel free to drop it down on the chat box. So about the SDOH Academy, the SDOH Academy is made up of multiple HRSA-funded training and technical assistant partners. This academy puts together virtual trainings to help health centers develop, implement, and sustain social determinants of health interventions. The series of webinars will assist with finding resources, experts on subject matter, and allow peers to link together. Each webinar will equip participants with tools needed to increase their competency in 4 core areas of the SDOH response strategy. So about the breakthrough series itself, our target audience is going to be staff from health centers and health center controlled networks. The time commitment is going to be April the 8th, the 15th, the 22nd, which are previous sessions that already happened, and today, which is our session on the 29th, and it will be happening from 3 to 4 p.m. Eastern. Registration, you should have already gone through that, and recordings are going to be available at the end of the presentation, and they will also be available in our website. About the faculty, about the organizations that are involved, the following that you see here in the screen are organizations that are part of the SDOH Academy. See a little few of those there. And about the learning objectives for this session, the first objective that we have is going to be to explore critical vulnerabilities of essential workers during public health crisis and natural disasters. We're also going to go ahead and discuss the role of health centers in addressing clinical outreach and legal protections for essential workers. And we're also going to share some resources and strategies to address SDOH issues for essential workers during and after an emergency. The following are the staff that are going to be on this call. We have Jillian Hopewell, who is from Migrant Clinicians Network. We also have Alexis Gill from Farm Worker Justice, myself, Hansu Ibarra from MHP Salud, and Gabriela Castillo from Health Outreach Partners. So before we get started, we would like to do a little dinamica, a little icebreaker. We encourage you guys to participate through the chat box. We're going to ask you guys to let us know your name, the organization that you're from, the years of experience that you have. And then the question is, what do you prefer? Sweets, which would be your chocolate, your cookies, your cakes, versus your sour candy, which would be your chamoy, your tamarindo, salty stuff, lemon stuff. So feel free to participate in our little questionnaire. And let us know what you guys prefer, whether it's sweets or sour candy. So the agenda for today, we're going to go ahead and welcome everybody. After that, we're going to do an overview of essential workers and emergency preparedness. From there, we're going to go ahead and talk about policy and legal protections. We were going to go ahead and discuss the role of community health workers. And then we're also going to do, discuss outreach resources and materials, and then allow some time for questions that you guys might have for us.
Sorry, that's me. I was all caught up in what your candy preferences were. Forgot that it was my session. So my name is Jillian Hopewell, and I work for the Migrant Clinicians Network. And I just want to start with a recognition that in our personal and our professional lives, it can really feel lately like we're increasingly forced to confront various natural and public health disasters. I live in the town of Chico, which is right next to Paradise, California, and our region was totally devastated by wildfires in 2018, which I'm sure most of you have heard of. We had more really devastating fires in 2020, just as we're in the midst of dealing with the COVID-19 pandemic along with the rest of the world. And the impact of these various types of disasters have exposed fissures in our local safety net and laid bare many of the inequities that we know exist, but we're not always forced to confront. And I don't want to be a harbinger of gloom and doom, but I do want to highlight some of the disasters that different communities face as we think about how to address these issues for some of the most vulnerable in our communities. So on the next slide, I don't need to dwell on COVID. We all know very well the impact that this public health disaster has had on our communities. Our hope is that in the aftermath of COVID, we'll be able to better design our public health and social service systems to meet the ongoing needs that have been exposed by the conditions of this disease. Because it's clear that COVID-19 will not be the last public health disaster we face as a nation or as the world. And this graphic shows viral disease outbreaks since the year 2000, which hasn't really been that long. And while many of these were contained largely to a certain region, COVID has shown us the impact of a global pandemic, and we should anticipate future widespread pandemics as the people of the world are increasingly globalized. So many other communities, we've been confronted with natural disasters such as hurricanes, then floods, drought, earthquakes, wildfires. And then as we deal with the impact of climate change and these other natural disasters, natural disasters are really likely to increase and also bring about some ones that we maybe don't always think about, like extreme heat. And as we deal with the impact of climate change, these and other natural disasters are likely to increase, and particularly as the world heats up and extended heat waves, they'll become increasingly common. So we wanted to do a quick poll just to see where all of you are and what you have encountered in your workspace in particular. So what natural disasters or public health disasters have you dealt with, and choose as many as are relevant for you. And you should all see that poll on your screen there. Okay, sharing it. So yes, infectious disease epidemic certainly is going to be the highest one that we're all dealing with right now. But yes, hurricanes, floods, wildfires, drought. So everybody has dealt with at least one of these. And people are sharing others in the chat. Winter snowstorms in Texas. Absolutely. Absolutely. So extreme heat and extreme cold, both of those things. I don't know if there are any other things that haven't been listed that you all, but go ahead and put those in the chat and we'll respond to that. So moving on to looking at social determinants of health in disaster management. This photo is actually from Puerto Rico, where local outreach workers were meeting with community members after Hurricane Maria to talk to them about how to better prepare before a disaster strikes. Because experience has shown that social determinants of health greatly impact vulnerable community members in many ways. So here we talk about general lack of access to information about risk, and also a lack of lack of resources to prepare for disasters. So in both of these instances, there's a number of examples. I'm sure you have examples in your local area, but there were health centers that we were working with in North Carolina who really were struggling to meet very isolated farm worker communities to let them even know that a hurricane was on the way. And so that, things like that can be, before the disaster strikes, there are a number of different things that impact. And so that, and also includes a lack of inclusion in disaster preparedness efforts, and also access to communication platforms. And I'm sure there are other things that you all could list, but those are some of the critical things. And then again, this list could be much longer, but looking at some of the critical issues, housing risk, because people who are on the lower income levels are going to be likely living in housing that is more vulnerable, with locations that are more vulnerable. And then access to resources to mitigate the effect, like air conditioners or generators, or in the case of the winter storms in Texas, heaters, or plumbing issues, things like that. And then economic loss with resources that are more tied up in material goods and less in sort of bank savings and that sort of things, where they're going to be better protected during during a disaster. And then after, there's just like a whole plethora of issues that people face, but finding and obtaining aid and understanding that system, again, going back to my personal experience, I did a lot of volunteer work in the aftermath of the Camp Fire, which was the big fire that happened in Paradise, California. And the kind of aid system and the number, I mean, really great people, everyone with their best intentions, but extraordinarily complex and difficult to navigate, not always in languages that work for people. So those are definitely issues that confront people. And then just people who are already living on the edge, when a disaster strikes, then there's also a lack of access to housing, food insecurity, a lot of behavioral health, mental health issues that come along with all of those. And then some of the existing concerns for those people, lack of access to healthcare and other services, are just exacerbated. And finally, the role in cleanup and other services that allow communities to return to normal can be, those can often be dangerous positions. So that actually moves us into the next section that I want to talk about. So one of the really interesting things I think about COVID is that it has highlighted the role of sort of quote unquote essential workers. And I don't mean that they're not essential, but they've suddenly become or seen as essential, I guess. So in the chat, I'd love for you to talk about in your community, what types of work is seen as essential in the context of the pandemic. Yeah, grocery store workers, which I think that's a really interesting one, because that's not, I think that's probably a group I can say pretty confidently that's never been thought of before as essential. Gas station workers, that's interesting. Mm-hmm. And if you're typing in you may make sure that you select all panelists and attendees, because you might just be responding to a few people. Postal workers and grocery. So as we go through this slide shows just some of the occupations and the workers, and you guys can keep going on. Dental and vet services, that's really interesting. Daycare, restaurant and takeout. Mm-hmm. So that's interesting. So these are just a few of the ones then that during the COVID pandemic have really been seen as essential. I'm looking at a few more of the ones that people are doing: healthcare or health educators and pharmacy workers, judges, lawyers. Oh, interesting. Okay, thank you. Environmental services. It's also interesting, or I think it's sort of instructive to realize that more than 70% of immigrants in the United States are doing work that's classified as essential work. And a lot of it is the traditionally poorly paid and dangerous work. So one of the things I think that COVID has highlighted is the truly untenable position that many low-wage essential workers face in the middle of a disaster. So to keep an economy running, people are really forced to choose between working to meet their basic needs versus trying to keep themselves safe. And this is true whether it's a public health disaster or something like cleanup sites after a natural disaster or working in the field during a heat wave. And you can go to the next slide there. This just highlights that issue. So I think that we have put people who are facing a number of social determinants of health, a number of vulnerabilities, sort of one of the biggest ones being low wage work, and they don't have any cushion to fall back on. So without a cushion, they're forced into a position where they're doing dangerous work. This quote is from Gerardo Reyes Chavez from the Coalition of Immokalee Workers that many of us work with. And it's what this was during a presentation that he gave about the role of farm workers in the Florida community where he lives and works during the pandemic. There was also a disturbing trend, really disturbing during COVID that was exacerbated by the media by some politicians and others who were essentially blaming workers or low income people for their situation during the pandemic. And so there were things said like the home and social conditions caused meatpacking outbreaks, or living circumstances in certain cultures cause people to get sick, or they go to work in school buses and they're all packed in there like sardines. And it was really interesting. This is my editorial comment, I guess. It was very interesting because it was essentially acknowledging the impact of social determinants of health, but twisting it slightly so that rather than kind of looking at people being forced to live in situations that made them vulnerable, it was they're living in situations and therefore they are to blame for what is happening to them. So I found it to be an extremely disturbing trend, and I hope that it does not continue. So my colleagues are going to move into talking about some of our solutions, which include protections and resources for reaching the community. And all of the resources that we provide are fundamentally about building community trust to meet the needs of vulnerable people before, during, and after a disaster. That includes building effective partnerships between workers. I mean, in this case, we're talking about workers, community health centers, health departments, other community-based organizations, and employers. But there are other ones in other communities. There are other actors that can be brought into those partnerships. And then really critical is regulatory and policy solutions. So I'm going to turn this over to my colleague, Alexis, who's going to talk about regulatory and policy solutions.
Thank you so much, Jillian. My name is Alexis Guild. I am with Farm Worker Justice. And if you can go to the next slide, please. So I just want to build on what Jillian was discussing in terms of the issues experienced by essential workers. And in these slides, when I'm talking about essential workers, I'm really talking about those low-wage essential workers that Jillian referred to. So those who work in agriculture, meat packing, poultry processing, and others. And it's important when you think about how disasters are impacting essential workers that we think about two issues in particular. And again, this builds off what Jillian was sharing during her presentation. One being the working conditions and the other being access to benefits. And the reason why we focus specifically on working conditions is that, you know, oftentimes low-wage essential workers aren't really able to protect themselves because of their working conditions. If we look at the pandemic, for example, many of the reasons why the low-wage workers, essential workers, such as farm workers, meat packing workers, poultry processing workers, the reason why these communities were so disproportionately impacted by COVID was really due to those working conditions. They lacked control over their working conditions, and therefore they were more vulnerable to exposure of COVID. So there are a few things in particular that I want to highlight. One being a lack of sick leave. If you can go back for 1 second. One is being the lack of sick leave. You know, oftentimes low-wage essential workers, low-wage workers don't have sick leave. And so not having sick leave impacts their ability to access healthcare. It, during the COVID pandemic, impacts their ability to take time off to get tested, to take time off if they're sick with COVID, if they need to care for relatives with COVID. There's also a real fear of employer retaliation. And this is especially true for those who either are undocumented or are here in the US on temporary immigrant visas. As Jillian mentioned, the majority of low-wage workers, essential workers, are immigrants. And their immigration status certainly impacts their social determinants of health. It impacts their ability to access healthcare, but it also impacts their ability to assert their rights in the workplace, because they're often fearful that maybe their employer may retaliate against them, either by firing them, by calling immigration services, or especially for H-2A and H-2B workers who are here in the US on temporary non-immigrant visas and are brought to the US by an employer. They're fearful that if they were to speak up about unsafe working conditions, that their visas could be terminated. So that's something to really keep in mind. And then of course, lack of protective equipment, as Jillian highlighted when talking about COVID, oftentimes low-wage workers aren't provided the adequate equipment to protect themselves during a public health emergency like COVID, or during wildfires, as we saw in many photos that were taken during the California wildfires, farm workers who were out in the fields and were sometimes only wearing bandanas because that was all they had access to. And they were continuing to work even when the air quality was extremely hazardous. Another thing I just want to mention is access to public benefits. Especially after a disaster, there are certain programs that people may be eligible for, including emergency housing, emergency income assistance, emergency food assistance. But being able to access information about those services is extremely difficult. Jillian also mentioned this as well, especially if there is not information in a language that you speak. If it can be difficult to find out where to get the information, having to go onto websites or call phone numbers, being able to figure out, am I eligible? Oftentimes, many of the benefits have immigration restrictions. And so especially housing assistance and income assistance, you have to have a certain immigration status. You also have to navigate various state benefits and state eligibility. There's a lot that you have to go through, and it's extremely challenging for especially workers who may not be aware of their rights, who may not have information in a language they speak, especially if they don't speak English, and many speak languages other than English, and many speak languages other than Spanish. It may be very difficult for them to obtain information about their eligibility and their ability to be eligible and in order to access those benefits. Next slide, please. So I just want to talk a little bit about the protections that are in place, or the lack thereof, and especially as they pertain to COVID, as they pertain to wildfires. And then I'm just going to talk briefly about other occupational safety and health protections specific to agriculture. We are a farm worker organization, so a lot of our work focuses on agriculture specifically. So many of these occupational safety and health protections are specific to agriculture. But I want to talk a little bit about COVID to begin with. So there is no federal standard to protect workplaces. And without that federal standard, there has really been a patchwork of regulations across the country in terms of, what employers are required to do to protect their workers from COVID. A handful of states have actually put in place their own regulations in the absence of a federal standard. Washington, Oregon, Michigan, and Wisconsin specifically put in regulations specific to agriculture. Again, because many of the vulnerabilities that these workers face are in the workplace. And so these states specifically put together and implemented regulations to protect agricultural workers in their workplace, as well as in shared transportation and housing, because many workers do share transportation to and from the fields, and especially those who live in employer housing, live in shared housing controlled by the employer. A number of other states, including California and Virginia, have put in place protections for all workers. Some other states have put in protections specific to employer retaliation, but federally there is guidance, and guidance is not enforceable. So, having those protections in place are really important, of course, in understanding which states have these workplace protections, so that workers who may see violations have remedies to correct them. We talked about wildfires. There's actually no federal wildfire standard. The only state currently with a wildfire standard is California. In California, what they have done is they essentially put in place a standard that requires employers to provide training and instruction to workers about the health effects of smoke inhalation, their right to seek medical care, and then also requires them to provide protective equipment such as respirators and N95 masks, as well as to relocate workers or change schedules depending on the air quality. And so that is in place in California. And then other occupational safety and health protections I want to mention, and again, these are specific to agriculture. There's a protection called the Field Sanitation Standard, and this essentially is a regulation that requires employers to put in place access to hand washing stations, access to clean water, and access to toilets. If we're thinking about COVID, the reason why this is so important is because workers often don't have access to protective equipment. And so being able to access hand washing stations so that they can follow CDC guidance is crucial. And the Field Sanitation Standard lays out regulations about how far hand washing stations can be, and requires these supplies are in place for workers in the fields. There's also what is called a worker protection standard, which protects workers against pesticide exposure. Even though pesticides may not necessarily be an emergency per se, pesticides are a really important health factor for agricultural workers and affects not only the workers themselves who may handle the pesticides, but workers who are around the pesticides, as well as their families, because workers can often bring home pesticide residue and expose their families to that as well. And then there is a heat illness standard in California, Washington, and Minnesota. We know that workers, outdoor workers, have died because of heat stress and heat stroke, but only a few states have standards in place to protect workers, especially as climate change continues and we have more high heat days in the summer and other parts of the year. These heat illness standards are extremely important. Next slide, please. So with all of these legal protections in place or policy protections in place, either at the state or federal level, it's important to think about how health centers can partner with legal services, because oftentimes you as a health provider see these issues, you see these patients, you hear about their exposure, due to their workplace, their exposure to heat, their exposure to COVID. And in order to remedy that, it's important to bring in legal services. And this is actually from the National Center for Medical Legal Partnership. And medical legal partnerships allow for that whole person approach to a patient, thinking about not just their immediate medical needs, but what are the broader legal needs in order to ensure that that patient is able to access healthcare, is able to have a healthy home, is able to have wages, able to access the benefits that they're entitled to. And especially when it comes to these emergencies, and especially navigating all the various benefits that a patient may be eligible for post-disaster, working with legal services to ensure that these patients are aware of their eligibility for these benefits, able to navigate the system, and don't have to be fearful about any retaliation from their employer for trying to access these benefits is crucial. So I wanted to share that to conclude my part of the presentation. And this actually goes very well into how partnerships can promote access and promote the ability for patients to confront their social determinants.
Closing remarks,
so I'm going to turn it over to Gabriela.
And before that, Emily, it looks like you were unmuted, I think.
Hi, everyone. I'm Gabriela. I'm with Health Outreach Partners, and I want to just sort of have us take a step back and understand sort of what outreach is and the potential role that it can play in emergency management before, during, and after. So in particular, addressing SDOH issues for essential workers. And as you all know, outreach plays a critical role in facilitating access to primary care, case management, health education, and social services to underserved populations. And in our national outreach guidelines for underserved populations, we have defined outreach as being part of the process of improving people's quality of life. Can we go back? And we do this by facilitating access to quality healthcare and social services, as well as providing health education and case management to ensure continuity of care, as well as connecting communities to social services, and also bringing linguistically and culturally responsive healthcare directly to the communities who are most impacted, and helping people to become equal partners in their healthcare is important as part of the outreach work. And lastly, just increasing the community's awareness of the presence of underserved population among many of the other roles that outreach holds, but all within the context, like Jillian said, with trust with the communities that you serve. So when a disaster occurs, outreach work is critical in ensuring our most vulnerable communities, like our essential workers, have the access to take care of their health for themselves and their families. And because outreach workers serve as the link between health centers and underserved populations, it's critical that health centers have a plan in place to continue doing outreach work. Next slide. So I wanted to focus a little bit on what the national outreach guidelines are, and just share out how they could be shaped under an emergency or disaster management. So this pyramid here are the considerations or guidelines that a health center's outreach program should entail. A strong outreach program will offer the best opportunity for the most vulnerable populations to be connected to and engaged with their social and health needs during an emergency or disaster. So these guidelines are presented here into three categories. We have our person-focused guidelines, our community-focused guidelines, and our program-focused guidelines. So under each guideline, several possible strategies for implementation are suggested, and the guidelines are accompanied with strategies, and they're really intended to provide direction for how to most effectively use outreach to increase access to and utilization of comprehensive primary care services. So when we look at these guidelines under the lens of an emergency preparedness, we want to ask ourselves how the work may shift. So before diving into our role of community health work, I just wanted to sort of just go over some of these. We can start with the community focused guideline and see how that sort of shifts under emergency preparedness. For a community focused program, it's mostly set up to promote healthy, supportive communities. And we've all have learned how this component of our outreach programs proved to be vital during this pandemic. So for any future disaster management, we anticipate that this will be amplified during any emergency or disaster, natural disaster. So how do we continue having a presence in the community? Part of our prep work is to find those linkages with the vital community-based organizations that people are already accessing. How do we provide information? How do we assess what languages are being used for the resources we're currently passing out in the community, as well as education? Who are your people who are providing the education to the community? Are you incorporating disaster education, disaster management education in your resources? And how do we meet people where they are during a disaster? People completely switched to remote working. So how do we shift our work from where people live, work, and play to where they are during a disaster? For our program focus guideline, this concentrates on what an outreach program can do to ensure outreach efforts are efficient and effective. And our outreach programs can maximize their resources and their impact by integrating outreach efforts within the administrative, clinical parts of the health centers, and being able to provide comprehensive planning processes, including disaster preparedness, documentation, and evaluation for future disaster preparedness. So according to HRSA Health Resources and Services Administration, health centers must have risk management policies and procedures in place that continually and proactively identify and plan for potential and actual risk to the health center in terms of facilities, staff, clients, patients, financial, clinical, etc. And so health centers need to have clear policies and procedures to prepare for and manage emergencies before, during, and after. So being able to have an assessment of how these current policies need some updating or may need to think through other newer natural disasters that we may not have seen in the past. So as your health center plans for disaster management, it's important to include outreach workers in the development of this plan. This plan should entail outreach components like mentioned before, identifying those linkages, those task forces, those partnerships, doing an inventory of current partnerships and see where the gaps for social needs are. It also includes addressing communication needs. Do outreach workers know their role in information sharing during a disaster? And like mentioned, in the different languages, catering to the populations that you serve. And laying out very clear roles and expectations of what outreach workers and community health workers should anticipate in taking on in the case of a disaster. So I'll pass it on to Hansel now. Oh, just very quickly, this is what I just spoke on. Yeah, so just outreach workers and community health workers and preparing, they go hand in hand in ensuring that the communities are being able to access the healthcare that they need during, before, and after. So these are some of the bullet points that I just highlighting in ways that outreach workers and community health workers can work together to best serve the communities. So now we're going to ask a poll. Does your organization have a community health worker or outreach program? Okay, just a few more moments and I'll now pass it on to Hansel.
All right. So I was saying, we do see that about 64% of you guys are aware of what a community health worker is. We had 29% say that they did not, and we had 7% that were not sure. And for that 7% that isn't sure, this slide is going to be for you guys. So what are community health workers? A community health worker, also known as an outreach worker o promotora de salud, is a frontline public health worker who is a trusted member or has an unusual close understanding of the community they serve. This trusting relationship enables the worker to serve as a liaison, a link, an intermediary between health, social services, and the community to facilitate access to services and improve services delivered quality and cultural competence. We say trusted members of the community, since most of the time the CHW, the community health worker, are from the same community they serve, speaking the same language, sharing the same beliefs, understanding those beliefs. CHWs benefit from knowing how the community thinks and how to approach them culturally appropriately. Now that we know what they are, we can go ahead and look into who can be a community health worker. And this is going to be anyone who has an understanding of the community. So this would be, but not included and limited to, languages, beliefs, culture, fears, worries, stressors, et cetera, et cetera. Where do you look for possible CHWs, community health workers? As mentioned, they are from the community. And now that doesn't mean that someone from outside the community would do a bad job, but you want someone who would be able to at least communicate with the people and have a passion for helping them. With that being said, a priest can be, or a leader in your community health, teachers, community leaders, active members, all of those can be, could possibly be community health workers. So as a clarification, individuals do not need to be from the same community, but that is always a plus. Now, why are CHWs the right choice? They are the right choice because they are from the community, and that gives them a special understanding of what the needs that this community has, the fears that they have, as I mentioned, the beliefs, the language, and their social norms. Now that we've discussed the who, what, where, and why of the CHW, we're going to go ahead and touch base on the when, as in when do CHWs come in handy? They come in handy when trying to reach those who are most vulnerable in a community. Today, we are focusing on emergency and vulnerable populations. So things such as natural disasters, which would be your earthquakes, hurricanes, tornadoes, snowstorms, drought, etc. We also have your pandemics, which would be what we're experiencing right now with COVID-19, and also assisting in vaccines. They also assist in emergencies that consist with chronic disease, which would be your diabetes, obesity, substance abuse, heart disease. They also assist in foodborne illnesses, situations when you have E. coli, salmonella outbreaks, they go ahead and assist there. And also with non-health emergencies, such as emergency housing, assisting with bills, and food pantries. Some emergencies may affect certain groups, especially underserved populations, differently within the community. CHWs are invested in their communities and can help the community return to a sense of normalcy after a disaster has occurred. So the role of the community health worker, like I mentioned, emergencies affects certain groups differently, and the community health worker ensures that every group that no one is left behind. And they do this through 3 stages. The first stage is going to be before the emergency happens or getting ready. And they assist here by helping prepare a plan of action. They also offer resources to the community, such as sandbags, shelters, food aid, list of aid organizations, et cetera, et cetera. They also assist with collecting census information. And this is going to be information such as who lives in the community, where the houses are located, who may have special needs during this emergency, such as pregnant women, elderly individuals, those who may lack transportation. An example of what an outreach worker can do here is going to be mapping, or another way that they can do this is assisting mapping farms and labor camps locations, since addresses may not be reliable to those rural locations. Aside from assisting before an emergency happens, they also assist during an emergency. And this is going to be assisting individuals to connect them with key partners, and also to serve as a relay point for information. And they also assist after the emergency has happened, and they do so through screening and assessing the damages, offering support groups, clinical and non-clinical wise, providing information, offering resources at one more time, housing, food, financial assistance, list of aid that's available in the organization, and also connecting community workers with key partners. So the following here are going to be different roles that the CHW has been playing in different emergencies. The first one is with COVID-19. Maine CDC is using currently CHWs to spread information and educational efforts about the vaccine itself. And if you guys are interested, I went ahead and included the link so you can go ahead and see what type of plan they are using at Maine. Another organization that's using CHWs for emergency preparedness is going to be the Farm Worker Care Coalition. This organization utilizes CHWs to reach farm worker communities. The coalition focuses on 4 areas, which is going to be disaster preparedness, education, public health, and social justice. And I've also included the website there in case you guys have questions. Another emergency that the CHW can assist with is going to be with the fires, as we mentioned earlier, specifically the California fires. I went ahead and included a link to a book that explains the need for disaster planning when it comes to California fires, as well as existing inequalities and the uses of outreach workers to assist to reach this vulnerable populations. In another situation or emergency that CHWs can assist would be with hurricanes. More specifically, we can think about Houston. Houston has been hit with quite the amount of hurricanes recently. University of Houston utilizes CHWs to help those who are most vulnerable in the community. They utilize CHWs to assist in preparing and recovering stages of Hurricane Harvey. The following here is going to be quotes from organizations that are using CHWs. This is a quote promoting CHW as a possible solution for emergency preparedness. The quote here says, the immediate objective of utilizing CHWs is to enhance primary and behavioral healthcare capacity, health literacy, especially among disadvantaged and underserved populations. And this quote is from a research paper conducted by the Deepwater Horizon Medical Settlement and the University of South Alabama Coastal Resource and Resiliency Center. This came out in 2014. And they basically spoke about the CHW role in assisting with the oil spill and response and recovering for that. Another quote that we have here says, community health workers, CHWs, and promotores de salud are playing an increasingly important part in delivery of high quality and equitable health-related services, particularly to vulnerable populations. This quote is from a research report conducted by the Health Force Center at University of California, San Francisco, their health campus, and this was conducted back in 2017. They concluded the importance of the CHW, the community health worker role, and the need to connect intervention and support opportunities across a spectrum of policy, care delivery, and workforce development to ensure the usage of CHWs in healthcare teams. I also wanted to go ahead and include quotes from a specific CHW that work with us. This CHW, her name is Ms. Medrano, and she shared with us a story about a man. They joined a program for depression and to battle diabetes. His lack of motivation was obvious. He would constantly repeat, I am tired and I want to sleep. Ms. Medrano knew that she had a big task ahead and continued to push and motivate him to continue through the program. His initial A1C was at 12.9%. After 3 months, it dropped down to 7%. By this time, noticeable changes in the man were visible. He was happier, and he thanked me for the help and the guidance I provided. Upon successful completion of the program and implementing behavioral changes, his A1C level went down to 5%, and he was told by his doctor that he no longer needed to take medications. His life changed dramatically. As he expressed, I am 100% a new man. Definitely the work this community health workers do is important for diabetes management. As Linda states, or Ms. Medrano, we help them understand their doctor's language, refer them to the needed services, provide knowledge about how to care for their diabetes and live healthier lives. People really do not have a knowledge and they think it is the end of the world, but with the knowledge, they can live a long and long and happy life. And this, as I mentioned, was a quote from one of her CHWs that was dealing with her diabetes program.
Thanks, Ansel. So really quickly, I just want to highlight this resource on Health Center Emergency Preparedness and Management that Health Outreach Partners and MHP Salud collaborated on. So this tip sheet focuses on how outreach workers can support 3 of the basic emergency management expectations for health centers, including emergency management planning, linkages, like we mentioned, partnerships and collaborations, and communications and information sharing. So this resource also highlights how outreach workers can speak to the needs of underserved populations and can very much either represent the community that they are serving on planning committees, building needed partnerships or task forces, or can even identify leaders of the community to serve on certain committees or task forces. So this resource also highlights the importance of integrating outreach workers, community health workers in the design, implementation, and evaluation of emergency drills and real emergencies. And as Hansel said, there's a lot of roles that outreach program staff can do to prep for a disaster, like collecting data on where people live and what are some of the barriers that they may experience during an emergency, like transportation, access. It also provides examples of what outreach workers can assist with before, during, and after an emergency. So with that said, I just wanted to offer this resource as one of the many other resources that we have listed here. And I'll pass it on to Alexis to speak on some farm worker justice resources.
Thanks, and I'll just talk quickly. Just, I shared a lot about various policies and protections that are in place. And so we have a lot of resources that are available around COVID-19, around emergency preparedness, around occupational safety and health, and around medical legal partnerships. So all of the links are on this slide, and I encourage you to check them out.
Great. So lastly, we have more resources listed here. We have our friends from the National Nurse-Led Consortium on considerations for serving residents of public housing during emergencies and disasters, a webinar from Migrant Clinicians Network on COVID-19 vaccines, a national learning session from the front lines of refugees, migrant, and immigrant health. And lastly, a guidance on how to protect volunteers from COVID-19 during natural disaster response and recovery. All resources where we could benefit from lessons learned for any future emergency management. Next slide. So that is the end of our presentation. We will now want to move on to any questions or answers, comments, feedback.
Can I make a comment? So one comment I'd like to make is, so if your health center does not have an outreach program or a community health worker program, I encourage you to partner with a community-based organization in your community. Many of them do have promotores de salud, do have community health workers, have outreach staff, and they know the community well. They have done various education programs, and they would be great partners as you think about expanding your outreach into various communities.
With that being said, I can also include that MHP Salud does offer trainings for CHW supervisors and CHW workers. And we also have guidelines to establishing CHW programs. So if you guys are interested in starting a program, if you already have a program and you want to maybe increase it, or you want to take it to the next level, you can always go to our website at MHP Salud. And like I mentioned, we do have some guidelines and resources there to start CHW programs and how to implement them, continue, et cetera, et cetera. This time, do we have any questions, comments, or concerns? Anything you guys would like to ask us about? Anything you would like us to maybe touch back on, offer more information on?
So it looks like we have a couple of comments, one from Bethany from National Center for Medical Legal Partnership that mentions that the American Rescue Plan supports community partnerships. Absolutely. So thank you for mentioning that, Bethany. And then we also have a question, and this is perhaps for Hansel, about resources for reimbursement with insurance companies. So if health centers are interested in bringing in community health workers as part of their primary care team, what reimbursements are available?
It is to my understanding that it goes on a state-to-state basis. So it all depends on what state you're from and what your state allows you to do. But if the state does allow it, Medicaid does provide what's it called, reimbursement for CHWs, for individuals that are using CHWs. What I can go ahead and do, I believe it was Carrie, I can take down your information. And if you're interested, or better yet, if you want to shoot me an email, and we can go ahead and get together and we can discuss this further and see what state you're from, and we can see how that goes about with the CHW in providing. But I am aware that there is reimbursement, but as I mentioned, it just depends on the state that you're from. And let me go ahead and move to the following slide. That way you guys can go ahead and see our emails. As I mentioned, to that individual that was asking me about the reimbursement, my email is available there under Hanso Ibarra. Go ahead and shoot me an email and we can go ahead and discuss that further.
And it looks like Bethany shared a link to some resources for community health workers through Medicaid. And one person is asking about volunteer opportunities.
With volunteer opportunities, as in volunteering with an organization to be a CHW?
It's not entirely clear.
I mean, if either way, if you do want to go ahead and participate with your local organization, it's just a matter of reaching out to that agency, asking them what is some of the requirements. MHP Salud does use some volunteer, community health workers. So there's a possibility that an agency close to you, if they offer community health workers, that they might allow you to volunteer with them. Any more questions? This is your opportunity to pick our brains, to ask us any information, and we can go ahead and try and answer those questions for you guys. Anybody experiencing emergencies? Anybody maybe have CHWs that you want to share how that's going with you guys?
We answered all their questions, it seems.
I believe we're also going to be having an office hour. So in case you guys are a little bit shy and you would like to go ahead and ask us more questions, I believe we are going to be offering sticking around for a little longer.
We do encourage you to check out our websites for more information about any of the information that we shared during the webinar today.
Can you guys hear me?
Yes, ma'am.
Yes, hi, Tessa.
Hi, everyone. Thank you so much for this presentation. My name is Tessa. I work at the Utah Department of Health, and I work as the Community Health Worker Liaison. So appreciate this so much, and a lot of the work that I've been focusing on this past week, or this past year, I wish it were a week, is community health workers as well. We have the COVID Community Partnership that we have done over the past year that has been a wonderful project, something I'm happy to share more about. But you mentioned Maine and a few other states, but I was just curious what other state projects I could look into just to learn more about community health workers during COVID or during crises, just as we continue to look forward and plan our project.
So there is another organization, give me 1 second, let me find it for you, that are utilizing CHWs, and they have a playbook that they're promoting so that other health centers can go ahead and incorporate CHWs to them. Give me 1 second as I find that for you. I believe it's called the Alliance. Give me 1 second and I'll get that for sure for you. Let's see my TA calls. They are called the Community-Based Workforce Alliance, and they have a playbook that, as I mentioned, provides guidelines as to implementing a CHW and using the CHW to encourage vaccine itself, and also promoting education. Let me, if you want to go ahead and shoot me an email, and then I can go ahead and send you that link, and I can go ahead and also connect you with those members of that agency in case you want to go ahead and utilize their playbook and want to ask them any questions.
Sure, that sounds great, Ansel. Thank you.
Yes, ma'am.
And yeah.
Ooh, I believe you cut out.
Yeah, I was just going to say, if any other state comes to mind for other successful projects, that would also be super helpful. So I will email you. Thank you so much.
Yeah, go ahead and email me. We have presence in 5 different states. MHP Salud does, so I can for sure give you 5 other states that I might have not mentioned in this presentation that are utilizing community health workers.
Awesome. Thanks so much.
Yes, ma'am. Any other questions, comments, concerns? And I guess just to throw it out there, in regards to the first question we asked earlier about sweets or sour, I myself, I'm more of a sweets person. All right, so I believe we are in our office hours now. So if anybody has any questions, there are less members now, so maybe you feel a little bit more at ease as to ask us some questions.
Does anyone participate in a medical legal partnership?
I'll share, Alexis.
Yeah, please.
NNCC has a nursing legal partnership, which is not really that different, but it's only different because we use the legal team partners with our nurse home visitors, which is a slightly different model than the one that health centers would probably use, since it is based in sort of the home visiting space. But it has been incredibly helpful because the majority of or I wouldn't say the majority, but a lot of the SDOH issues that our clients face are legal in nature, and in terms of, making sure they have housing and making sure that their workplaces are safe and things like that. So it's been really, really valuable. I know that the clients that our nurse home visitors serve are pretty much the same clients that our health centers here in Philadelphia serve as well. So it's really, really been incredibly useful and helpful for our nurses to have those legal experts to contact and liaise with. So yeah, thanks, Bethany, sharing that.
I think sometimes people think of medical legal partnerships and they have this specific idea in mind of an attorney or a paralegal sitting in the health center and doing intake. And certainly that's one model of medical legal partnerships. But I know from our experience in farm worker communities, medical legal partnerships often look a little bit different. And that's often because, there are just numerous challenges to making those connections and to ensuring that farm workers are informed about their rights. And so it can be just referrals. It could also be serving on the boards of directors of each other's organizations, or doing trainings together. So, there are so many ways to partner, but it's vitally important because as I shared, these legal protections, are oftentimes in place, but, workers may not be aware of them or may not feel comfortable, asserting their rights. And so having that connection, if they trust the clinician, but may not know the legal services provider, being able to have that connection and do that warm handoff and ensuring that worker is informed about their rights and comfortable asserting their rights is important for their health, especially during an emergency.
Yeah, and I will share also just, not only does the medical legal partnership work help with individual patients, but back in, I guess it was 2015 or maybe 2016, there was a health center here in Philadelphia that really was working with the medical legal partnership to help patients who had HCV try to get around the sobriety restrictions that Pennsylvania had in order for them to receive treatment and sobriety and fibrosis score restrictions. And they actually were successful in threatening to sue the state, and the state ended up changing their fibrosis score requirements so that those individuals at those health centers could be treated. So it doesn't only, you know, I think it doesn't only have those like individual implications to do that work, but really can have some amazing policy change, you know, potential if folks are finding that their population as a whole is facing an issue that could use some advocacy. It's really when sort of the legal partnership piece becomes so valuable on a larger scale. So just wanted to share that story of, you know, I know it's not necessarily related to CHWs, but definitely was a great outcome for an MLP.
No, thank you, Emily, for sharing. And Bethany mentions that too. And, you know, in places like Washington State, for example, that and Michigan that passed these emergency regulations to protect workplaces, agricultural workplaces during COVID, that was really a coalition between health centers, legal services providers, other organizations in order to get those regulations put in place. And so, you know, certainly those outcomes are another really important piece of medical legal partnerships.
Does anyone have any other thoughts on or experiences with disaster management before, during, or after, and your vulnerable populations? Challenges that you're having that you could use just some sounding boards, or solutions that you have found?
Jillian, we do have a question in the chat, in the Q&A box, while people are thinking about that. Ted is asking about NCQA guidelines, and if you see SDOH is taking on a larger role as part of the medical home recognition process.
So, you know, we're not officially part of the medical home recognition process, or the, you know, the certification that they undergo. So I don't know whether or not it will be. I certainly hope it will be. And I think that there's an increasing recognition of the impact of social determinants of health. And I really do think that if that we get anything positive out of COVID, it may very well be that, just the recognition of how much all of these sort of this constellation of issues affects people's health and their access to it, and then how in turn how that affects us as a society. So, and yes, and Emily also says the fact that HRSA is also including SDOH screening on their UDS is very encouraging. So I think there is increasing, you know, it's one of those things, right? Like, we can all believe all these things to be true or important, but when it becomes a part of the official accreditation or certification or review process, then things, that's where things really start changing. So I certainly hope so, Ted. But I don't know the answer about whether it certainly will or not. What about some of the rest of you? You can unmute, or you can just type in a question. Oh, you have to raise your hand to unmute. Emily's in control. I was curious, Gabriella or Hansel, have you had experiences with people implementing some of the resources that you highlight in the in the publication, the joint publication that you have. The one, Health Center Emergency Preparedness and Management, that really focuses on including outreach workers and community health.
Yeah, that's a great question, Jillian. As far as I know, I don't think we have like received any information on who has really implemented that information concretely. We've just received feedback of folks just letting us know that it's been helpful to consider for a plan.
That's great. It'll be interesting to see as it gets implemented more. Well, do we want to, we might want to go ahead and close out unless there are some last minute questions or thoughts that folks want to share. Hansel, do you have any thoughts on closing us out? Or
if they have any questions, any concerns that they did not end up expressing, they do have our emails there. They can feel free to go ahead and shoot that question to any of us or to all of us, and we'll get back to them as soon as we can with an answer to that.
Great. Thank you all for sticking with us today. And
yes, thank you all for sharing your time, for being here with us, and may you all enjoy the rest of your afternoon.
Thank you.